Council of Governors blame a lack of resources on their refusal to sign the health workers' return to work formula. The nurses' union accused the governors of doublespeak. However, a section of healthcare workers in Mombasa returned to work today after agreeing on fresh terms with the county government, raising hopes that other counties will follow suit. Gina Kirori has the details.
A tough-talking Council of Governors backed their earlier stance on the ongoing nurses' strike earlier today, stating healthcare workers who do not return to work will face a number of consequences as the court held that their strike is illegal.
No worker should expect to walk out of their jobs and then walk back when they do so wish. The county governments are not a revolving door. We are monitoring and shall circulate the names of the employees who have been terminated on account of indiscipline.
The governors accuse healthcare workers of manipulation.
Then it's marks of something like blackmail. Because if you have a pandemic where no other countries in Africa, where you don't have health personnel going on strike.
Nurses state that until their terms are met, they will remain on strike. They accuse the Council of Governors of being hot and cold on the matter.
Chair wa Council of Governors, huwezi ongea sehemu mbili za mtomo kwa wakati mmoja. Wakati mwingine unasema kwamba hatuna pesa ya kuweka bima. Wakati mwingine unasema tuko na bima. Kwa nini hiyo mikataba ambayo ni ya bima isiweko kwa meza?
But in response, the Council of Governors say that they lack the resources to meet the nurses' demands.
The Kenya Union of Clinical Officers signed a return to work formula with the Ministry of Health on 1st January 2021. The Council of Governors was not consulted prior to the execution.
As far as the Ministry of Health is concerned, this is out of their purview.
We will not interfere. We cannot in law go and tell a county government whether to hire or to fire any of its workers, let alone the healthcare workers.
According to COG, another spanner being thrown in the works of a resolution to the perennial issues is the upcoming election within the health sector.
Na ujue pia saa hii tuna election ya union. Umeangalia hiyo yote, umeona? Pengine hao watu wanaangalia wanataka wachakuliwe tena.
Kusema kwamba ni siasa kwa wale wa nurses ambao wamefariki mpaka sasa 34 ambao ni wa serikali ni kama 29, kwamba hiyo ni siasa, huo ni mchezo.
But the proverbial light at the end of the tunnel may have been offered today as doctors and clinical officers under the Mombasa County government have finally agreed on a return to work policy, helping services resume at public health facilities in the county. The agreement between the Mombasa County government and healthcare workers may pave the way for the resumption of services in other counties, but the stalemate between the Kenya National Union of Nurses and the Council of Governors rages on, leaving patients in the waiting room. Gina Kirori, NTV.